Welcome to our in-depth look at posterior capsular fibrosis, often referred to as PCO or after cataract. If you've had cataract surgery, this is a condition you should be aware of. We'll explore what PCO is, why it happens, how it's diagnosed, and what can be done about it. So, what causes posterior capsular fibrosis? Well, it's primarily a consequence of cataract surgery. During cataract surgery, the cloudy natural lens of the eye is removed and replaced with an artificial lens, known as an intraocular lens or IOL. The surgeon leaves behind a thin, transparent membrane called the posterior capsule. This capsule acts as a support for the IO. Over time, cells remaining on the capsule can proliferate and migrate, leading to thickening and clouding. Let's delve into the pathophysiology. Think of the posterior capsule like a clear window behind the IO. After surgery, leftover lens epithelial cells, or LECs, which were originally a part of your natural lens, can start to multiply and move onto this capsule. These cells can then transform into two main forms: fibrous tissue and Elschnig pearls. Fibrous tissue causes wrinkling and thickening, while Elschnig pearls are small, bubble-like formations. Both of these processes reduce the clarity of the capsule, resulting in blurred or distorted vision. Posterior capsular fibrosis is a very common occurrence after cataract surgery. Studies show that it can affect a significant percentage of patients, some estimates ranging from 20 to 50%, within a few years of their procedure. The risk can vary depending on factors like the type of IO used, the surgical technique employed, and individual patient characteristics, such as age and health status. How will you know if you have posterior capsular fibrosis? The primary symptom is a gradual blurring or haziness of vision, similar to how your vision was affected by the original cataract. You might also experience glare or halos around lights, and difficulty seeing in bright light. It's important to note that these symptoms can sometimes be mistaken for other eye conditions, so a proper diagnosis is crucial. Diagnosing posterior capsular fibrosis involves a comprehensive eye exam. Your ophthalmologist will examine your eye, often dilating your pupils to get a better view of the posterior capsule. Using a slit lamp, which is a special microscope for examining the eye, the doctor can directly visualize the thickening or clouding of the capsule. Visual acuity tests will also be performed to assess the impact on your vision. While there aren't distinct types of PCO in the same way as some other diseases, it can manifest differently in different individuals. Some may experience more fibrous changes, leading to wrinkling and distortion, while others might primarily develop Elschnig pearls. The treatment approach remains the same regardless of the specific appearance. Fortunately, treating posterior capsular fibrosis is a relatively simple and painless procedure called YAG laser capsulotomy. In this procedure, a YAG laser is used to create a small opening in the center of the clouded posterior capsule. This opening allows light to pass through clearly, restoring vision. The procedure is typically performed in the ophthalmologist's office and takes only a few minutes. No incisions are required, and most patients experience immediate improvement in their vision. The procedure is usually a one-time treatment. There's no guaranteed way to completely prevent posterior capsular fibrosis, since it's a natural consequence of cell behavior after cataract surgery. However, certain techniques during the original cataract surgery can minimize the risk. These include careful polishing of the posterior capsule and the use of IOLs made of materials that discourage cell migration. Research continues to explore new ways to reduce the likelihood of PCO development. The prognosis for posterior capsular fibrosis after YAG laser capsulotomy is excellent. Most patients experience a significant and lasting improvement in their vision. While the opening created by the laser is permanent, complications are rare. Research continues to focus on refining IOL designs and surgical techniques to further minimize the risk of PCO and enhance long-term visual outcomes after cataract surgery. Thanks for watching, and we hope you found this informative.